The pneumothorax reader study is looking at an algorithm which GE designed, which helps detect pneumothoraces, so punctured lungs on plain chest x-rays. This has already been tested against radiologists, and they know that it works to a certain degree. The idea was to bring that algorithm and just see what was the impact on the kind of frontline clinicians. So not just the seniors, not just the specialists, but generalist clinicians, and generalist clinicians of all different grades.
A lot of the imaging algorithms that are being developed at the moment are there as help to the clinical staff. They're not standalone diagnostic algorithms. And what we want to be able to show is actually when you give the algorithm output to the clinicians, it improves their practice. Now, chest x-rays are quite commonly acquired imaging. And as a result, there's a large variety of people who have to look at these chest x-rays and interpret them. And we wanted to measure the impact of the algorithm on the performance of each one of these individuals.
What we undertook was a big data set of about 400 images, half of which had punctured lungs pneumothoraces and half of which didn't. And we spent a lot of time trying to curate the data set so it had a real range of pneumothoraces, really hard ones to pick out, really difficult ones, images with lots of tubes, lots of distracting things, or sort of patients that were hunched over or slumped that were difficult to read, to try and put the algorithm through its paces. And then we essentially got all our clinicians to read through the whole data set, all 400, without the AI, and measure their accuracy. And then we gave them a bit of time to forget about it all. And then we ran it all again, but this time with the AI. And then we compared the difference in terms of their accuracies.
The fact that everybody improved, even the experts got better, was good to see. But the most junior group of clinicians showed the most amount of improvement. When you put the results together with the AI, the performance of the juniors and more senior people was very close together. So what you're doing is really upskilling workforce to be able to perform higher level tasks.
The next stage is actually to get this stuff working more prospectively, actually in the real clinical environment. The emergency department is busy with a lot of clinicians working there, a lot of clinicians at different grades coming in and off shift, and of course just a vast number of patients, and that makes it really distracting. It makes it a very easy place to make mistakes. So something like the pneumothorax algorithm, the idea that would just come into that space and work away in the background and be able to perhaps offset that distracting environment by just being a constant marker for when it thinks there's an abnormality, and just make it easier for the clinicians to spot. And you can really see how something like this could actually really expand in the future and develop into something much bigger than the sum of its parts.